So today I'm just going to show you what we've been doing in terms of putting together the Planning Alternative Tomorrows with Hope process to create a vision for end-of-life care in Health Works, and I'm going to take you through what we've done. So we started with a group of 55 people focusing on the blue sky vision, and here we see with the big star what our blue sky vision for end-of-life care is all about. We then moved from the blue sky vision to think about where we wanted to be in 3 years' time, and here you see a visual representation of that, which we've translated since doing this into a document that is a plan for us to move forward. We then stood as if we were 18 months on and thought about what we would have achieved by then. And then we went to 1 year and thought about what 1 year would be like and what would have happened at that point. And then we went to now, and we thought about how we felt today in the room, and a great outcome of that was that people felt optimistic, they felt safer in an uncertain world, and they felt as if we had actually started to create a movement for change, which was really, really positive. So we've got lots of great stuff going on. Because that's where we got to on that particular day, we had to get together again, and so the next part of it we undertook about a month later, where we had a smaller group, but even so we spent a good 2.5 hours working through what would life be like 6 months down the line, and what would that look like. Then what strengths did we need to build in order to take this forward, this work. And a big one is about, there was a lot of stuff that came out of that was all around people and professionals and getting them to start working in different ways. And then the next stage was, who did we need to enrol, and the big group that we need to use as an asset is the patients and the carers in this whole process, and hospital doctors also came out as being really key to all of this. Then we created our next steps, and a big one is getting the strategy signed off by Health Works and getting commitment to move forward with it, and various other things as well. And finally, first steps. What are the things that we're going to do tomorrow? And we spent quite a long time thinking about some early wins that we were going to create. So we now have a really comprehensive plan that's going to take us on a journey to a place where my story of my life and the death that I want to experience is at the beginning and the start of my process and my journey, where we have a really strong philosophy of how we're going to care for people. We start to blur the boundaries, and we have health professionals working alongside link people to actually create the time to help people to navigate the map to the journey that they want to take.
Christine, what time's the meeting?